Hey, my name is Dr. Sean Price. Welcome back. In this video series, we've been talking about the three main aspects of healing and of healthcare, and getting your body in the position where it can start restoring its function and actually get back those levels of healing and those levels of function that we also desire. And today I want to talk about the chiropractic adjustment, how that's a critical and integral part of everything that we're doing. We've talked pretty extensively about the metabolic aspect of treatment. We've talked pretty extensively about the neurological aspect of treatment. Now we're going to talk about the chiropractic, which is actually your structural. This entails chiropractic adjustments, it entails postural rehab, it entails muscular therapy such as massage and so on and so forth. But I want to talk specifically about chiropractic today. And the way that this works is you've got your spine and your brain actually sits up here. This is the base of the skull. The brain sits up here, forms the brain stem, and it continues down through this hole. And then it continues down through the spine as the spinal cord. Now each one of these little nerves that you see is where the signal coming from the brain will exit to go out to control certain tissues. So depending on which nerve level the signal comes out to, that determines where the signal is going. So if the brain, say, is going to send a signal out to the heart to maintain increase heart rhythm or whatever it's going to do, it's going to send that signal. It's going to come out somewhere in this area. Hand, arms, ears, eyes, nose, throat's all going to come out in the neck. So different parts of the different regions of the spine have different areas of the body that they supply, so therefore carry out different functions. So the way that works in translation in everything that we're doing here in the office is you've got the brain, and the brain sends a signal to the body. Then the body carries out certain functions. Now this diagram right here explains everything that we've been talking about between the brain, the neurological aspect of care, the metabolic, and the structural. So neurologically, if the brain is not functioning properly, then you're not going to have proper signals going down the spinal cord out to the body. So if you have aberrant brain function for whatever reasons, and we talked about all the reasons that can happen, if you have aberrant brain function, we've got to fix that, and we do that through our functional neurology. If the signal gets down, goes through the spinal cord the way it should, gets out to the body for the body to carry out the function, if you have abnormal metabolic function, if you don't have the materials, the building blocks, the amino acids, all the metabolic activity that has to be there, proper thyroid function, proper blood sugar handling, proper adrenal function, if all these things are not functioning properly and the body's not able to carry out the signal that's coming from the brain, then the brain's going to send that signal and the function's not going to be carried out. Okay, so we got to handle the metabolic aspect. So this is neurological, this is metabolic. Now structurally, chiropractically, if there is what we call a subluxation, and that's where one of these vertebrae in the spine shifts out of place. When it does that, it causes an impingement on that neurovascular bundle, and that interferes with the signal of what's going out to the body. So if you get that subluxation, then you're going to have abnormal signaling going out to the body. So we have to have all of these aspects in this chain for the body to carry out normal function. Okay. Now, what's the key about this? The body is very, very good at compensating for things. Okay, so let's say you have a subluxation, or let's say you have a bad brain signal. Over time, what's going to happen is the first thing that you're going to get is you're going to get malfunction. Okay, you're not going to necessarily have symptoms, but you're going to have malfunction. So if it's a structural issue, instead of being able to turn your neck this far, you turn here and you compensate. So you hide the pain, you hide the malfunction. If it's a thyroid issue, you start having decreased thyroid function, but you don't feel the effect of it, you just have decreased thyroid function. If it's blood sugar handling, same thing. Whatever it is, wherever it is, you'll have this malfunction, but you may not be feeling the effect of it. If it goes on long enough, you end up passing over what we call a pain threshold or a tolerance threshold, and that's where we get into symptoms. So when we see patients in our office, patients have passed into this symptom phase most of the time, and most of the time we're the last resort because they haven't been able to get these symptoms resolved. So our goal in treatment in using the metabolic, neurometabolic, the muscular treatments, the chiropractic treatments, all of these treatments work together to handle all these systems and improve the body's ability to function and get you as close to 100% function as your body will go. And once we get there, when the body can function at a higher level, the body is designed to heal, and the body can heal itself. So that's the basic premise behind why we use chiropractic and how it all fits in together. Hope that makes sense, and I'll see you on the next video.